Welcome to the University of Iowa Healthcare Organ Transplant Center video education series. As a recipient of a donor organ, you will need to take medicine every day for the rest of your life. This is because, as a transplant patient, your immune system sees your new organ as a foreign object and will try to get rid of it. This is called organ rejection. To prevent organ rejection, you must take immunosuppressants or anti-rejection medicine. This lowers or suppresses your immune system. With your immune system lowered, you will be at higher risk for infections. It's a balance between lowering your immune system to avoid rejection and minimizing the risk for infections. While these new changes can be challenging or scary, they can get easier and become part of your daily life through three key ideas known as the 3 C's: consistency, compliance, and communication. It is important to take your medicine consistently, be compliant with your medication plan, and communicate with your transplant team. Let's start with what it means to take your medication consistently. It is helpful to create a routine where you can take your doses every day at the same times, such as 8 a.m. and 8 p.m. If you miss a dose, take it as soon as you remember, but never take 2 doses at the same time. To help keep you organized, you will be given a pill box. You should also keep an up-to-date list of all your medication with you at all times. If a medicine changes, update your medication list and pill box right away. You should also fill your prescriptions using one consistent pharmacy. Upon discharge, your best option is the University of Iowa Healthcare Discharge Pharmacy, if your insurance allows. For refills, the UI Healthcare Specialty Pharmacy is the most convenient choice. The pharmacy can mail the medication to your home, and your transplant team can tell you about your medicine, refills, and side effects. UI Healthcare's transplant and pharmacy teams work together and use the same system, making it the safest choice for patients. The second of the 3 C's is compliance. Your anti-rejection medication plan will likely change over time, and staying compliant with these changes is vital to your post-transplant success. In addition to unexpected factors, other medication can interfere with your anti-rejection medicine. Inform your care team about any new medication or changes to existing ones. This includes medicine prescribed by other providers like doctors, dentists, or pharmacists, as well as any over-the-counter drugs. Some foods, supplements, and teas can also affect your anti-rejection medicine. Special instructions are listed on your teaching sheet. To get ready for this new routine, let's dive into the 3 most common anti-rejection medicines. These medicines are tacrolimus, mycophenolate, and prednisone. These medications are taken each day. Tacrolimus and mycophenolate are both taken 2 times each day, 12 hours apart. Prednisone is taken 1 time each day in the morning with food. Each medicine carries the chance of having side effects. The most common are shaking or tremors caused by tacrolimus, diarrhea caused by mycophenolate, and impacts to your mood, blood pressure, or appetite caused by prednisone. There is a full breakdown of dosages, special instructions, and possible side effects for each of these drugs in your teaching sheet. Your transplant nurse coordinator or pharmacist will fully explain each medicine and answer your questions. Being compliant with the dosage schedule and communicating any concerns or side effects is key. Now that you've learned about the most common medicines for transplant recipients, let's talk about other medication you may need. Each person is different and has their own health conditions before their transplant. You may need to take extra medicine based on these other conditions. The full list of the most common medicines can be found in your teaching sheet. This video will go over a few issues that affect many patients. Patients often have issues with high blood sugar, high blood pressure, constipation, cholesterol levels, pain, and infections. If you have any of these issues, the dose you took to manage these conditions pre-transplant may need to be changed. Any medication you are prescribed will likely change over time. Patients often take more medication in the first 6 to 12 months after their transplant. After that period, the amount and frequency of your medication might be lowered over time. For example, medication may be prescribed to fight certain types of bacterial and viral infections that won't be necessary for the length of your transplant. Post-transplant, it is very important you continue to comply with all changes to your medication plan at the direction of your care team. Let's also quickly touch on immunizations. Immunizations are key for your health, no matter your transplant status. Transplant recipients need to be aware of a few changes to how and when they get immunizations. In summary, do not get immunizations for at least 3 to 6 months post-transplant, and avoid all live virus immunizations like the chickenpox vaccine for as long as you are on anti-rejection medicine. More details can be found in your teaching sheet. Remember, vaccinations will continue to be important. Staying compliant and up to date on your vaccinations will help you be successful post-transplant. Do not lose sight of what might be the most important of the 3 C's: communication. Transplantation is a big change for you. Your transplant team and other healthcare providers are here to support you. Communicate any changes or questions around medicine, immunizations, or changes in your health with your transplant nurse coordinator. Also tell them if you have any side effects from medicine as outlined in your teaching sheet. This may be a sign that your medication plan needs to be changed. If you're struggling to get your medication for any reason, such as cost, change in insurance coverage, or a drug shortage, please reach out. Your care team may be able to help. Your care team is a resource and here to support you as you get used to this new lifestyle. If you feel overwhelmed or you're not sure what comes next, remember that following the 3 C's is a key to success. Consistency in your medication routine, compliance with your prescribed medicine regimen, and routine communication with your transplant team will help you live a better, healthier life after transplant. For questions or more information, please talk to your transplant nurse coordinator at the University of Iowa Healthcare Organ Transplant Center. You can also review any of these excellent resources listed here. Thank you for watching.